A nurse staffing shortage at Hamilton General Hospital led to ICU patients having to be diverted to other hospitals. Patients have stopped being diverted for the time being, but as Simone Gavros tells us, the chances of this happening again could still be a possibility.
It's being described as a dynamic situation. That's what Dr. Craig Ainsworth is saying about Hamilton General Hospital diverting its ICU patients to other hospitals after running into a nursing staffing shortage.
There's chronic health human resource challenges, especially with nursing staff and especially in specialized ICUs like we have at Hamilton General Hospital that look after the sickest of the sick patients. It's been very challenging to replenish an exhausted workforce post-COVID.
They began diverting critical care patients last Saturday.
There are 65 level 3 ICU beds here at Hamilton General Hospital, and about 1/3 of them have been closed for the last several months due to staffing.
The number of patients sent to other hospitals wasn't confirmed, but Ainsworth says they were in the single digits.
There are just some patients that cannot be redirected, i.e. patients who come into our emergency room have some sort of acute medical issue that's local to us in Hamilton. There are systems in place that bring those patients directly to Hamilton General.
We're alarmed and concerned, but not exactly surprised.
Grace Pierius with the Ontario Nurses Association says this staffing shortage has been a problem for a while, with wages, workload, and safety concerns as the driving force.
There's an absolute panic amongst some emergency nurses that have reached out. It's another last straw for a lot of people.
The province says last year was a record-breaking year for new nurses. But one of the biggest challenges hospitals are seeing is keeping nurses. And Pierius says ICU nurses are not easily replaced.
There's an incredible amount of investment that goes in, both on their part and sometimes on the hospital's part, to educate and bring them up to the speed and the standard they need to be at.
Pierius says long-term solutions need to be thought of to retain nurses and avoid straining other hospitals.
The wages need to be there, certain safety standards. There's too much violence at the bedside. There are so many issues and so many ways this needs to be tackled.
Ainsworth says the General Hospital will continue to struggle to maintain capacity for the next few weeks, possibly into the early fall. Simone Gavros, CHCH News, Hamilton.